Sick of the climate change. Climate change makes the planet sick. Climate change makes a person sick. Need of the hour? Climate change is cited as the cause of recent increases in allergy and asthma prevalence. The escalation of respiratory allergies and asthma is driven by the heightened presence of greenhouse gases and prolonged pollen seasons attributing to longer allergy seasons. As temperatures increase, warmer air helps to form ground-level ozone, sometimes called smog, which is a powerful air pollutant. Ozone irritates the lungs, which may trigger an asthma attack. Asthma and allergy symptoms can be worsened by mold growth, increasing storms, precipitation, flooding, temperatures, and humidity. Allergic rhinitis, the sixth most prevalent chronic disease worldwide, impacts around 1 million people each year. In India, allergic rhinitis has surged in prevalence over the past 2 decades. Among adults, it affects 20% to 30% of the population, while children aged 6 to 7 and 13 to 14 experience rates of 11.3% and 24.4% respectively. This condition, which afflicts people of all ages, often goes untreated as it's perceived as a mere nuisance. The most common triggers include pollen grains, dust mites, animal dander, insects, pollution, and food allergens such as milk, egg, soy, wheat, nut, or fish, prawn, almonds, mushroom, ripe mango, rajma, cinnamon, beans, and areca nut. Allergic rhinitis is triggered by various allergens, which cause cardinal symptoms such as sneezing, itching, runny nose, and nasal congestion, leading to sleep disturbances. AR is often accompanied by various comorbid disorders such as asthma, chronic otitis media, rhinosinusitis, oropharyngeal lymphoid hypertrophy, secondary obstructive sleep apnea, and disordered sleep due to shared inflammatory pathways. Untreated AR symptoms can exacerbate these conditions, creating a cycle of worsening comorbidities. Lifestyle adjustments play a crucial role in mitigating air pollution and climate change. Here are some practical steps. Shift to sustainable transport. Opt for public transport, cycling, or walking instead of private motorized vehicles to cut down greenhouse gas emissions locally. Transition to renewable energy. Embrace renewable energy sources and support the phase-out of coal power to foster a more environmentally friendly economy. Time management during pollen season. Reduce outdoor activities, especially during high pollen days or peak traffic hours, particularly for pollen allergic individuals. Indoor protection. Stay indoors during air quality alerts or high pollen days and maintain air-conditioned environments with regularly changed filters to minimize allergen and air pollutant exposure. Personal hygiene. Wash exposed skin and clothes after outdoor exposure to remove pollen residues that can trigger allergies. Mold prevention. Avoid damp indoor environments to prevent mold growth, which can exacerbate respiratory conditions. Similar symptoms. Air often resembles a common cold with sneezing and a runny nose. Duration distinction. Symptoms lasting over 2 weeks signal something other than a common cold. Root cause. Unlike the common cold, AR is not caused by a virus. Mucus appearance. In AR, mucus is clear and watery. In a cold, it's thick and yellow or green. Differentiating symptoms. Fever, malaise, and sore throat are more common with a cold. By recognizing these differences, accurate diagnosis and appropriate treatment can be pursued for allergic rhinitis. Allergic rhinitis therapy should be tailored based on the severity of the disease, comorbidities, treatment availability, and affordability. To treat allergic rhinitis effectively, a stepwise approach is key. This involves allergen avoidance, pharmacotherapy, and possibly immunotherapy. Focus on relieving symptoms and preventing complications. Optimal treatment includes second-generation oral antihistamines and intranasal corticosteroids, especially for moderate to severe cases. Combination therapy may be needed for persistent symptoms, improving control and quality of life. This comprehensive strategy ensures better management and symptom relief for allergic rhinitis patients. Addressing the persistent burden of air is vital for enhancing quality of life and productivity.